commitment, dedication, and sacrifice from our gallant frontline workers, we can say now with pride, and to paraphrase what His Excellency the President used to say in the heat of the panic, this indeed has now come to pass. Although I'm not suggesting that COVID-19 is a disease of the past, we may still assert that the world has collectively made significant gains in bringing the disease and its accompanying devastating consequences under control. We all have to thank the Almighty God for how far He has brought us in this battle we fought against an unseen enemy. However, we need to remind ourselves at the same time that the disease persists, albeit in a more manageable form, and thus the preventive protocols of masking, avoiding crowds whenever possible, and keeping good personal hygiene through hand washing and sanitization remain useful for prevention of infection. Ladies and gentlemen, the 7-member board of directors, which I had the privilege to chair, and the administrator were sworn into office and publicly inaugurated by His Excellency the President on 8th of April 2020. We were charged with responsibility to manage contributions received both in cash and in kind to support those who were directly engaged in the combat of the pandemic and support those infected with or afflicted by the coronavirus disease, especially the socially needy and vulnerable. Due to the critical nature of our responsibilities, we started operations on that same day and have discharged our duties per the Act up until today, that our operations are coming, on the eve of our operations coming to an end. We, the trustees and the staff of the fund, owe a huge debt of gratitude to the numerous donors who made immense contributions to the support of the trust fund in the discharge of our statutory mandate. But before I formally thank our generous benefactors, I would like to highlight what we have been able to do for, or rather what the donations that we have received from our benefactors have enabled us to do for our nation. So you appreciate the extent to which they deserve the commendation and gratitude we wish to express to them. Distinguished invited guests, the Ghanaian public responded so generously that about 85% of all the contributions we received from its inception to now, the fund received from its inception to now, were received within the first 3 months of its establishment, i.e., from April to June 2020. In the heat of the pandemic, the most common call on all media platforms, as well as from public places, was for the supply of more PPEs for both frontline workers, security agencies, and the general public, so as to ward off or control the spread of the disease. Distribution of PPEs. Well, the heading is distribution of PPEs. The trust fund acquired and distributed PPEs to a cumulative total value of 22,113,760 Ghana cedis. We distributed these to 56 regional, municipal, and district hospitals, COVID-19 management care centers, isolation centers, 8 testing centers, and about 226 CHIPS compounds across the length and breadth of the country. Also included was the support given to the school reopening committee to procure PPEs for distribution to students in tertiary institutions. The testimonies shared by the heads and managers of these facilities and institutions indicate that these donations made a great difference and brought relief to staff, students, patients, and institutions under their care. In the area of information and public education, towards the effective performance of our statutory function and to better inform the public on the nature and cause of the disease, its prevention, management, as well as the significance of adherence to declared safety protocols, the Trust Fund decided to partner with certain relevant state and non-state organizations, such as the NCCE, the National Commission on Culture, the Risk Communication Department of the Ghana Health Service, Ingenious Africa, Ebeye Foundation, these are NGOs, and to encourage uptake when eventually vaccines to control the virus were discovered and made available. In total, an amount of 4,359,854 Ghana cedis was spent on public education, awareness raising, sensitization, and information dissemination on the pandemic. Furthermore, the Noguchi Memorial Institute for Medical Research, the Vet Services Directorate of the Ministry of Agriculture, were supported with a total amount of 7,555,882 cedis to purchase reagents through the Ministry of Health to enhance the availability of testing materials of the virus during the heat of the pandemic. Support to care management centers. The fund provided various supports towards construction, rehabilitation, and equipping of COVID-19 care management centers, isolation centers, hospitals, and other medical facilities to the tune of 8,637,280 cedis, 56 pesos. The beneficiaries include the National Infectious Diseases Center at Ga East, Pantang Hospital, Cape Coast Teaching Hospital, and the Greater Accra Regional Hospital. Social interventions. We also made social interventions because of the second part of our responsibility, which was to help alleviate the plight of people who had been infected or otherwise affected by the pandemic. In this regard, we provided various support towards, as part of this mandate, we distributed food items that we had received, in-kind items such as tinned food, liquid soap, rice, pasta, soft drinks, biscuits, bottled water. We distributed these to vulnerable groups such as children's homes, including the Osu Children's Home, and district and private orphanages. Through the Help Age, we made distributions to groups of the aged. We made distributions to children's hospitals, especially during the national lockdown. In addition to these, the Trust Fund engaged the services of the Institute of Statistical, Social and Economic Research, ISA, to conduct national survey on the impact of the coronavirus on households in Ghana for the purposes of identifying extremely vulnerable households to be provided with funding support. Eventually, an amount of 500 cedis each was paid through the Apex Bank to 7,927 identified poor and vulnerable persons across the country affected by the pandemic. And this amount totaled 3,963,500 cedis. Indeed, we had earmarked 5 million cedis for this activity, intending to distribute to 10,000 persons. But for various reasons, including the fact that in some districts, the hostility of district authorities to the design of the donation program, which was intended and purposed to afford total inclusiveness within the designated social group. Because of all this, we were unable to meet our target, so the balance was paid into the account of the fund at the Bank of Ghana. Furthermore, a total amount of 210,000 cedis and 210,030 cedis was utilized to settle bills relating to the mandatory quarantine of a group of 42 Ghanaian deportees from La Côte d'Ivoire. And they had been quarantined in Sunyani, and this was as a result of an appeal from the Bono Regional Coordinating Council. Medical research and innovation support. The fund committed resources to support research and innovation on various aspects of the most effective way of combating the pandemic. And institutions such as the Kumasi Center for Collaborative Research in Tropical Medicine, the Noguchi Memorial Institute for Medical Research, the Center for Plant Medicine Research at Mampong Ekwapem, and the Institute of Statistical and Economic Research, ISA, were supported with cumulative amounts of 4,995,375 cedis to conduct various levels of research on the COVID-19 pandemic, thereby contributing to the advance of knowledge and understanding of the virus and ensuring effective combat against the COVID-19 disease. Other interventions were in the form of the distribution of 10 Chevrolet Cobalt saloon cars to the underlisted institutions, and they are all set out, various hospitals, management centers. These are separate from the other funds that we made available to some of these centers. A variety of PPEs and other relief items were donated to persons displaced by the extraordinary tidal waves that hit Ada, Keta, and Kokrobite on 15th December. Because as a result of the displacement, people had to be crowded in facilities such as church halls and school classrooms, thereby increasing the opportunity for infection. We also distributed relief items and PPEs to the following facilities following the tanker explosion disaster at Apiate in the western region, for the same reason as we had also made distributions to the displaced persons. So we made distributions to Takwa Municipal Hospital, Bogoso Health Center, Apinto Hospital, Inner City Clinic, as well as to individuals at the holding centers where displaced persons were kept, and also the Wasa Akropong Government Hospital. Towards the assurance of transparency and accountability, the fund established a system whereby in the case of all distributions or support programs, there will be a written donation agreement signed with each beneficiary institution, spelling out how they are to use the items donated and the conditions for disbursement, such as all the various conditions that must be adhered to under the Public Finance Management Act and the Procurement Act. Our key policy guidelines were the disbursement policy formula and procedure guidelines, and donations and receipts policy. On procurement, both parties ensure procurement intended for each product is in accordance with the Procurement Act. As I've already said, I don't need